an Angio Room that's been upgraded with brand new hardware, brand new equipment, and a more comfortable environment for our patients. And this Angio Room is one of our two Angio Rooms. This is now the more modern one and the main room that we use to support a number of programs across the hospital, across both sites actually. And some of the programs would be the trauma program. We use embolization techniques using angiography to stop bleeding in patients who are acutely bleeding. Our vascular patients who need stents or angioplasties are also being used on that in this particular room. And our cancer patients are used for biopsies and various types of lines that we use where chemotherapy is administered. And there's a lot of other programs that this room supports, probably about 10 to 15 programs in the hospital. The old room was outdated and the machine, the equipment was getting old, so it was time to refresh the room and get brand new equipment. So it does have the latest cutting edge technology for imaging. It does give very good images at a very low radiation dose. So our patients are exposed to less radiation when we perform these procedures. And it also gives extra enhanced software ability for us to perform additional procedures that we normally wouldn't have done with a little bit more ease. So the imaging is much clearer than the old imaging for sure, with a lower radiation dose, and subsequently we can give more precise diagnoses with some of the added software features that are included with the table, which we never had before. Oh, it's amazing. It's great. It's probably the newest room in the province right now, so it's kind of nice that it's here in Windsor, and it's wonderful. I've been using it for the past couple weeks, and it's been really great for our patients. Oh, it's used 24/7, so we use it absolutely throughout the week. We're using it. It's very busy. Many times we stay late to try and get to address our patient needs, and we use it for on-call procedures, emergency procedures. So this past weekend, I performed a procedure on a patient who was bleeding internally, and I stopped his bleeding in that Angio Room. So it's very beneficial. And I actually saw him today, and he looked great.